So what blood pressure medicine do you start off with? There's 5 or 6 categories of blood pressure medications. How do you know which one to start with?
There are, and it's a good question. The historic cheap answer has been always start with HCTZ.
And what's HCTZ?
It is a diuretic. It gets rid of the extra salt in your body. Wherever salt goes, water follows and lowers the blood pressure. There are other agents if you have diabetes. ACE inhibitors are important.
Why are they good for somebody with diabetes?
So what it does is reduce the risk of having damage to the kidney over time.
Okay, so it sort of helps the kidney as it's helping the blood pressure. And they, like everything else, there's side effects of the ACE inhibitors. What are some common ones?
The most common one is cough. People get a dry hacking cough in 10 to 15% of patients on it.
So then you can go to, instead of the ACE inhibitor, you go to the ACE receptor blocker?
Yeah, the ARBs are a close cousin. They don't have the side effects of the cough. They're now generic, so it's easier for patients now to get and pay for.
Good. So the old-fashioned diuretic, and then in certain patients, is it better if you're having trouble controlling the blood pressure? Is it better to double the dose of the one you got or to add a second one?
Most people would say, one, stick with the dosing that you're on. There are some caps. For example, going to the highest dose doesn't always give you a great benefit. But it's compliance. It's hard to remember to take multiple pills. So most of my patients, I try to stick to the once a day, and I try to keep them on the fewest pills possible. That gives you the best control of blood pressure.
Is it better for you to take the blood pressure in the office, or is it better for the patient to have a blood pressure cuff at home, or you have to use both?
The answer to that is neither one of those. Actually, the most effective way to measure blood pressure is what's called an ambulatory blood pressure monitoring, where a patient wears it at home for 2 to 3 weeks.
So that's ambulatory. They're walking around. They are measuring their blood pressure at all times.
Yes.
And you can look at that on a recording.
On a log, yeah. Now, not a lot of patients, qualify for that or need to have that done. Typically, what I would say is take it when you're relaxed. Try to avoid the nicotine or the caffeine just before. Certainly, anxiety and other stimulants can raise blood pressure. Yeah. And take it, taking it 5, 6, 7 times a day is only, I think, provokes more anxiety. So 2 to 3, 4 times a week. I tell all my patients blood pressure is a marathon, not a sprint. We're protecting you 5 years from now, not tomorrow. So we can be a little slow and progressive on the treatment of it.